Welcome to radiologyinfo.org. In this short video, I'd like to help explain to you how to read your mammogram report. A mammogram is a specialized X-ray of the breast that helps your doctor screen for breast cancer and diagnose the cause of breast changes, such as lumps, pain, nipple discharge, or changes in the breast shape or size. Mammograms can find breast cancer early, often before you or your doctor can feel a lump, which is why regular screening mammograms are so important for breast health. Remember, your radiologist wrote this report for your provider, and that can make it hard to understand. Some medical terms, such as abnormal, may look scary, but may not be serious at all. Your doctor can explain any of the findings mentioned in your reports. Many of the findings are commonly seen in many patients and will cause you no harm. Write down any questions you may have and talk to your provider or ask if you could speak to the radiologist. As for your radiology report, it is divided into different sections: technique, comparison, clinical history, findings, and impression. Each section contains different information. The findings section lists what the radiologist saw on your mammogram. This may include descriptions of how dense the breast tissue is, whether there are any lumps, tiny calcium deposits, also known as calcifications, changes in the breast structure, or differences between the two breasts. Findings may be normal, abnormal, but not likely to cause problems, or abnormal and may need further evaluation. It's important to know that dense breast tissue is very common, and it doesn't mean that you have cancer, although it may make it harder for us as radiologists to see lumps or other findings. Many mammogram reports include a BI-RADS category. It is short for Breast Imaging Reporting and Data System, and it's a way that doctors describe what they see on breast imaging tests. It helps make our reports clear and consistent, and it gives a sense of how concerned we should be about what was found. Category 0 means that the imaging test was incomplete and additional tests are needed, or it means that we need to find some of your older tests. Categories 1 and 2 are normal or benign findings that don't need follow-up. Category 3 is probably benign and typically requires a short-term follow-up mammogram. Categories 4 and 5 are findings that may need a biopsy to determine if cancer is present. Your healthcare provider will explain your category and any additional recommended steps. The impression section summarizes the findings that the radiologist wants to make sure your doctor is aware of. It lists the radiologist's conclusions and includes the BI-RADS category that we just talked about, along with clear recommendations. This might include continuing with your annual routine screening, coming back in 6 months for a follow-up, or getting additional imaging tests such as an ultrasound or an MRI. If a biopsy is recommended, remember, most breast biopsies do not find cancer. I want to emphasize that mammogram findings, so the findings we see, it doesn't equal cancer. And being called back for additional tests is common. About 10% of women need additional views or ultrasound, and the vast majority of these that are called back do not have cancer. Additional imaging means that the radiologist just wants a clearer picture to give you the most accurate results. Remember, your radiology report is written for your healthcare provider, and that can make it hard to understand. Again, write down any questions or concerns you may have and talk to your healthcare provider about any next steps. For more information about mammograms and breast health, visit radiologyinfo.org.